So good afternoon, everybody, and a very warm welcome. It's a real pleasure to be part of this roundtable with such a great and diverse group of patient organisations. Today, we're gathering to share some insights and experiences, but also to explore how we can collectively strengthen the voice of patients shaping their own care and the systems that support them. The theme of our discussion, as you all know, is patient empowerment and self-advocacy. And I think this is both timely and vital with all the changes in our healthcare systems that are continuing to evolve. But we all know that patients mustn't merely just be passive recipients of care, but they must be active partners in their healthcare pathways. So I really look forward to an interesting exchange where we can learn from one another and maybe challenge some assumptions, because I know from knowing all of you that we have a shared vision to advancing the role of patients in every corner of the world. So thank you all so much for being here this afternoon. Also a thank you to Therese from Neuroendocrine Cancer Australia. She can't be here just due to international timelines, but she has contributed some answers to the questions that you have all had in advance. So can I start by just asking you all one at a time to introduce yourselves, where you're from, your organisation, and really what empowerment and self-advocacy means to you personally. So can I start with you, Roy, just because you're at the top of the screen?
Yeah, Roy Farstad. I'm from Norway. I'm from the chairman in the NET Cancer Association in Norway. I have been a cancer patient for 25 years, and has been really lucky with self-advocacy, because when I was 15 years old, my doctor took me aside and was teaching me how to be how to do self-advocacy in the healthcare system when I was so young. So I think he's the reason for I'm sitting here today. So I have a lot of experience with that.
Wonderful. Thank you, Roy. We all need one of those doctors. And Kate.
Hello, everybody. I'm Kate. I work for Neuroendocrine Cancer UK. I was diagnosed in 2003, so 22 years ago. There wasn't a lot of support around back when I was diagnosed, so I had to learn to self-advocate. A few missed turns along the way, a significant misdiagnosis, and I learned to speak up for myself, and I want to be part of helping others do that too.
Thank you so much, Kate. And Lisa.
I'm Lisa Yen. I live in Los Angeles, California, in the United States, and I am a nurse practitioner by training. I support my husband, who was diagnosed with metastatic advanced pancreatic NET in 2015. So it's been more than 10 years, and I work for the Neuroendocrine Cancer Foundation as the director of programs and I don't remember. Okay, I work for the Neuroendocrine Cancer Foundation as the Director of Programs and Outreach, which means I curate the content and really help build and cultivate a community of support and resources. So it's great to be here. Thanks for the invitation. Oh, and in terms of your question, sorry, I forgot your question.
It's
In terms of your question about advocacy, I think that for me personally, as a caregiver, and then also in the community, it's really knowing who is my tribe, who is my go-to, feeling comfortable and confident, asking my questions, confident who has the answers, and feeling safe asking them, and supported in that. I think it's been helpful to have champions along the way, both in work, colleagues, as well as family and others in the community who have modeled it and encouraged it and been supportive of second opinions and connecting with others, as well as our own healthcare providers and experts who have been supportive of that as well.
Oh, thank you. Yeah, I think they're really strong topics that hopefully you can talk a bit more about as we go forward. Benard, hello and welcome.
Yeah, my name is Benard Rono. I live in Kenya. I was diagnosed with neuroendocrine tumor in 2015, and it was a diagnosis that I had never heard about it. I tried looking for information for neuroendocrine tumors, and I could not find. I asked my doctor about neuroendocrine tumors, and he was not able to give me convincing answers. So I reached out to CarciNor Cancer Foundation, and they gave me information. That is the time that I started to do advocacy for myself and also for the others in Kenya.
Thank you so much. And Sugandha.
Hello, I'm Sugandha Dureja. I'm based in New Delhi, India. I'm running a support society called the Carcinoid Neuroendocrine Tumor Society of India. I'm the director of this organization, and we've been working now since over 10 years in the Indian subcontinent, helping all neuroendocrine tumor patients who reach out to us from all countries in India and around. For me personally, I think advocacy in the Indian or in our context would mean giving a voice to patients to be able to express, to get clarity, to ask questions, and to be a partner in their healthcare. Thank you.
Yeah, that's so important. And I think that leads us quite nicely on to looking at some of the challenges that people face trying to speak up for themselves, especially in our different areas of where we live. So I wondered whether I could just turn to you, Benard, and just ask you what you felt were some of the challenges for people in your country around self-advocacy. You know, that could be fear of judgment or language barriers or knowledge, that things that you have witnessed while you've been advocating. Just on mute, Benard.
Sorry, yeah. So I was saying, I think the main challenge in Kenya is awareness about neuroendocrine tumors. And also when a patient is diagnosed with neuroendocrine tumor, they do not know what neuroendocrine tumors are. They cannot differentiate between neuroendocrine tumors and other cancers. So they actually lack that knowledge. And because of lack of that knowledge, they are unable to express themselves. They are unable to learn even because of low literacy. So they are not able to get information, and the information that they get mostly is in English or other languages, and it becomes difficult for them, especially those who have low literacy. It becomes difficult for them to understand what is the difference between neuroendocrine tumors and other cancers.
Mm. So it boils down to some of the basics of education, doesn't it? Education and knowledge and awareness, which are key things, aren't they, for self-advocacy? So thank you. Yeah,
yes,
that really resonates. Roy, can I ask you about, you know, any challenges you see in your country?
Yeah, we have the distance in Norway is pretty big. We have a really good treatment, but we are struggling a little bit with that. The local hospital don't send the patient to the center of excellence, and a lot of the patient get worried about why not. And we are talking, and we are asking the people, the patient, you have to ask the doctor why you don't get treatment at the center of excellence. Why do they treat you on the local hospital? And the patients think that's a difficult question to ask, because then they are critical to the doctors, and they don't want it to be critical because they want to be good friends with the doctors. And therefore we are asking them, giving them some tools to go and ask, why aren't you treated at a center of excellence? And I think that's something we're working a little bit with the patients. And also in Norway, the population is so low. We are just a small part of London. Population in Norway is so small, but we are a really big country. So a lot of the neuroendocrine tumors cancer patients have not ever met a patient with the diagnosis before, or the doctors have never treated a patient with this diagnosis before, like exactly the GP and stuff like that. And therefore, it's also important that the patient asking, what the doctors, what do you know about my disease? And that's a difficult question, because the doctors they are the king. So but the doctors they don't like to be a king. They want to be like a low, high hierarchy. So we are struggling a little bit with learning the patient. Just ask a question. It's not dangerous.
Yeah, and that interestingly, Therese from Neuroendocrine Cancer Australia responded to this, saying that she felt there was like a generational fear of over respecting healthcare professionals and feeling like you don't have the right to ask the questions. So I thought she also mentioned about, she finds that some of the patients don't know what to ask, which again was a bit something that Benard was saying, not having perhaps the knowledge, not knowing what they can question and what they can't. So thank you, that resonates. And I have to come to you, Sugandha. Oh, sorry, Roy.
But it's important that the doctors, the doctors in Norway, they wanted to get the question. They really want to ask the question if it is something, anything, because the doctors are so open to learning new things and want to send you to the right doctors and stuff like that. So it's important that you're taking this question. Don't be afraid of it, because the doctors they want to learn, and also they want to know that the patient are feeling safe in this environment they're coming into now, because they're going to stay there for a long time. So
really positive then, isn't it? It's like half the battle. Sorry, Kate.
I was going to say, I think that's true in the UK as well, because, why would they know that we have 14 NET centres of excellence? Like Roy says, it isn't a field that they would normally be in, so they wouldn't know, and certainly the patient wouldn't know unless we help and we advocate with them and teach them that this exists. And that I think that's part of our role as an advocacy body, is to help people learn about that, both the patient and the general medics, that there are specialists in neuroendocrine cancer available.
And just signpost them to the right people, like you do in other cancer types, I guess, which is really important. Thank you, Kate. Sorry, Sugandha, I have to come down to you because of the vastness of the country in which you live. And I think we have spoken about some of the challenges you have, but I wondered if you could just sort of speak about some of those.
Sure. So besides, of course, the things that the previous speaker spoke about, we have an added layer of challenges. We have a lot of socio-cultural barriers in our societies. There are people who still do not want to talk about their cancers, and there's a lot of hesitancy about coming out, speaking up about their cancer diagnosis, which also is a barrier to self-advocacy and asking for help. There are other, since India is a huge country, we have so many languages, so language becomes a huge barrier in many parts of the country where people would not understand information provided to them in English or any other language. So these are very unique challenges we're facing in our part of the world, and especially due to a multilingual and a multicultural kind of a setting. These kind of unique challenges need very specific and very different kind of workarounds and solutions that we need to think about.
Yeah, it's hard work. You definitely have a layer there that many of us can't comprehend, but you're doing a great job anyway with the work that you're doing. Can I just turn to you, Lisa, really, and just, I guess, specifically talk about some of the challenges in self-advocacy in terms of kind of confidence when you've got cancer, or when you're feeling a vulnerable stage of your life, really. There's no denying that.
Yeah, I think everyone has really mentioned very well external challenges, and that is, of course, overarching all of it. And then what you're asking about with the internal challenges are lack of confidence, and we all struggle with that. I mean, you're up against these big systems, the paternalistic systems and attitudes, the lack of knowledge and not having a champion or access to care or a NET expert. And then we're supposed to have confidence. And we're supposed to be able to know what to ask and how to ask. And meanwhile, you have this whole complex mix hodgepodge of feelings inside, all your fear, anxiety, and overwhelmness. And suppose walk in the doctor's office, the sterile setting where everyone's poking and prodding you, and that you're probably unfamiliar because, like Roy, like my husband, you've never been sick before. And then all of a sudden go up against a physician who's supposed to know everything and ask your questions, or perhaps feel like you're challenging their knowledge. And I think because of the paternalistic system, healthcare system, and attitudes, traditionally, we're not taught that that's okay, and that we're empowered to. And it may be, changing in certain countries and hopefully around the world, but it takes time, and it takes finding those doctors. I know Roy was saying, doctors he's working with, but not everyone's like that, and there's definitely a lack of trust because oftentimes, Kate also mentioned this when she was diagnosed, oftentimes there's so many negative interactions, and that really then feeds into this, this continued lack of confidence and lack of empowerment, and then almost a seeding of this bitterness and resentment then. So again, this really like mixed pot of emotions going in to an interaction. And then we're supposed to have confidence in what we're asking. It's really a challenge.
It's interesting, isn't it? Because you want nothing more than to trust your team. That's all you want. You want to be able to trust every word that they say. And yet you're finely tuned to everything they say. And, you remember what was said last time, and you remember what was discussed, and you probably remember the size of a tumor. And if something different is said at the next consultation, it sows the seed of, was that right? Is this right? And you're constantly second guessing if you want to trust every single word. But it's such a frightening landscape to be in. So
I think also coming from potentially what has been quite a difficult diagnostic pathway, there's trust issues are already a bit damaged potentially if you've been misdiagnosed, or if you've got healthcare professionals that don't really understand the disease or haven't sent you to expertise. All of that compounds with you're not starting at a great place, are you?
Absolutely. And our brains are wired to hold on to the negative interactions rather than positive. So then, we're coming from a more trauma-informed place and holding on to the negative interactions, and even less likely to trust because of that long pathway. Even for those who didn't have that, though, I mean, you could have had other negative interactions or other negative perceptions, perhaps even unrelated to cancer, but because of other experiences in the past or family-related experiences.
Yeah, definitely. Has anyone else got any question?
Yeah, I wanted to say, in places like in Africa where there is still a lot of cultural beliefs and belief in traditional medicine, a patient can be diagnosed with cancer, and it's difficult for them to really follow up with the doctors. And the referral systems, especially in Kenya, is so difficult. If a patient is diagnosed with cancer, they have to go to a health center which doesn't have all the equipment or even the medicine that are needed for treatment. So the levels where the patients have to go through to get to a specialist, and we don't have specialists in Kenya for neuroendocrine tumors. So here we are talking about maybe the doctors, the surgeons, and the oncologists. So by the time that the patient gets to see an oncologist, it has taken a long time, and on the way they might lose patience and also trust in the system. So it becomes very difficult for them.
That's really fascinating about, the other forms of medicine that might be seen as a priority or the first port of call for many people. I mean, that must be a massive challenge in terms of educating people about some of the the more traditional medicines or cancer medicines where you are, Benard?
Yeah, so it's actually a big challenge because I was talking to a patient who has a neuroendocrine the other day, and she has a lot of belief in traditional medicine than the conventional treatment. That she had been on treatment, she had been on injection for the last 2 years, and she doesn't believe anymore that this treatment will give her the much needed resolution of our problem. So I think the way we have our traditional healers promising that if they use their medications, they will be healed is another challenge. They have that convincing language that the treatment that they give is actually going to heal them, not to treat it. So yeah, it's a big challenge here in Kenya.
Oh, thank you. Thanks so much for sharing that. And I can imagine that's, you've got quite an uphill battle there, but I know you're definitely doing your best to deal with that or support that community. I mean, we've talked about some of the fears of speaking in front of healthcare professionals or asking questions, but I just wondered what you do as advocacy organizations to support your community to have the confidence to do that. I mean, I know we have question sheets, don't we, Kate? There's a list of questions that you can take to your doctors, or you can phone someone on a helpline and they'll go through some questions with you. But I mean, just a bit of a free for all there, what you have in your organisations to help.
In the Manchester patient support group that I run, we do have little mini practice sessions, and some of the patients like to say, well, this is what I want to know. How can I express that? And we'll say, well, say it out loud, say it, describe it, talk to, and they'll pair up with another patient and practice that this is what they want to ask, and they pretend that the other patient is the doctor, and they rehearse it. It's just what we've been doing, but it's nice because once they've said it, then they get a little bit more confident. And we also talk about the question, if not, why not? If they're going to do a treatment or not do a treatment, it's fine to not do a treatment as long as they understand why not. And if there's a concrete reason, we wouldn't respond to it, it's not suitable or whatever, that's fine. But if it's because nobody knew that treatment existed in that particular hospital, then that's not good enough. And we can coach about that, and we can help them advocate for themselves. And I think it's very important, and the feedback is that it's very effective. So that's one of the things we offer.
Thank you, Kate.
Kate, I think you really nailed it with support groups. I think support groups, which, of course, in our world of neuroendocrine, they're more networking groups. They're really key because they're a place where we've cultivated true community of support and resources where we can create and hold space. People feel safe, they feel heard, and through that, being listened to and heard without judgment, with empathy, and then having the opportunity to hear from others' experiences, others who are a little further ahead than them, to know that there's hope ahead, there's instilling hope, and then, of course, the knowledge. And of course, once they have some knowledge, then being able to pay it forward also helps increase their confidence. So all of it is this positive feedback loop that we're creating. And it's amazing that, yes, we have tools. That's all great, all the things you're doing and the tools and the coaching. But it's amazing how through community, it truly does empower people because they're seeing it modeled too for them. And they're seeing it modeled by us, by others in the group, and cultivating those presence skills, those qualities and the skills of being, which then will feed into then the actual doing, which of course with all those tools, which your organization has, many of the organization has, that then arms them after they're kind of increasing their internal resilience and capacities.
It's so lovely when they say, oh, I didn't know I could ask that. And then they go in and a really positive consultation. They have a really great outcome. They build a bit more relationship with their consultant, and it's wonderful to see because then it goes forward in a positive way.
Yeah. And oftentimes they say, I heard so-and-so did this, and so it inspires them. Or they, so they're modeling it from someone, for someone else and inspiring someone else and learning from each other. It's amazing.
But when I'm meeting patients, that's a question. I'm always saying that write a letter to the doctor, an email or a message to the doctor you're meeting, because if you're having question for your doctor, if you're sending them in, the doctor can give you good answers. Because if you're asking a question that's taking 10 minutes to answer, because the doctor has 20 minutes and he has a plan for the 20 minutes. And if you have a big question, you're destroying his hour. And you don't get good answers. Because he had to struggle through it and be quick because the next patient is waiting. So if you're sending in the question in front, if you have an opportunity to do that, then you get so much better question. And the doctor said, you have sent in your question, they are really big, you need a new appointment. You should get, if you're going to get a new good treatment, a good answer, I need to give you 1 new hour because we should get it. And that's also a really good thing, because we have a lot of questions when you're having this meeting with patient groups and stuff like that, because the patients it has a little bit difficult to see the difference between I having a Dureja cancer, that's totally different from a pancreas cancer that's on a neuroendocrine. So even my treatment doesn't help for a NET pancreas. And that's, people can think that's a little bit difficult to understand, because NET is NET, but it's not. So therefore we always say, if you can, send the question before to the doctors. And the doctor will be so happy. And the doctor also can see what level you are on. How much do you know about your disease already? So I see Sugandha is
It certainly helps. It helps. I'd love to share how we do it in India. So usually when patients reach out, I get them on a call or write them a huge email depending on the information sent in. I break down things for them in very simple language. I would start with the basics, start explaining what are grades, what are the primary sites, what do you mean by metastasis, and explaining all those things, which scan is needed, just helping them navigate the basics first. Then we come to the specific questions, and slowly what we've built over the years is a fantastic, very helpful WhatsApp group where we have patients who are now quite a few years into the disease, and it's so wonderful to see. It's very heartwarming that whenever a new patient enters the group and they start asking questions about things, there's so many people who are willing to answer, and they're willing to guide them. They'll guide them about the smallest things, like how you do after PRRT and what you're going to feel and what precautions you need and all those things. They just come in, and it's quite a thriving community now on WhatsApp, and we all meet online once a month, and we talk about each other's issues or just ask each other questions, any new information to share, basics to share, any kind of help for finding specialists and those things. So this is how we do it in our community.
Peer support's so important, isn't it? So important.
Yeah, in
A WhatsApp group of 7 WhatsApp groups in the UK, and there was a young lady recently, she's only 28, and she wanted to learn to self-inject her lanreotide to give her freedom to do whatever she wanted to do. And she was really, really frightened. But the other members of the group came on, and we had 3 that also self-injected, and they were telling her tips and sharing how they did it and the very first time they did it themselves. And they were so warm and encouraging to her. And of course, then she did it, and she posted that she'd done it that evening, and she was so proud of herself. And she said that the support and kindness that she received from the other people who had gone before her was just immeasurable, really.
Yeah, that's wonderful. Benard, were you saying something then?
Yeah, and to give my experience in Kenya, we come from various geographic areas, and we are not in, most of our community actually lives in the rural areas.
Mm.
and it's difficult to reach at them. And also, so what we did is to start we have a WhatsApp group that we usually communicate to each other, and occasionally we do have online meetings. So in that group, I have become the doctor of the group because of the knowledge that the medical knowledge that I have. So most of the time I get referrals and I get questions from the patients, and I do have to do research and read about neuroendocrine tumors, and I give them the information. I usually ask them to go and when they visit their doctors, they ask questions concerning what they have, what questions they have. So we really have a vibrant WhatsApp group, and that's where we really communicate most of the time.
It's a great way of
Occasionally, I have.
together, isn't it?
Sorry.
It's a really nice way, it seems, to bring people together just on a WhatsApp group.
Yes, yes. So occasionally I have to call them one by one because some do not have access to internet, and also their phones are the old ones, the ones that do not have internet. So sometimes we call one another, and I answer some questions and I refer them to the doctors to ask more questions for what they did not get properly from me, or what they did not understand from me.
Yeah, I mean, I think we all have to think about the digital divide. I know we've got different reasons for it, but there isn't always in every country everybody on the internet. For many countries, it's an age thing. But as you've said, this could be just due to your infrastructure in your country, or the fact that they're rural. So I think it's something, I know we all use digital so much, and here we are on Zoom, but I guess we have to think about making sure we reach out to everybody in the best way that we can. Otherwise, we're excluding some people, I guess, aren't we? Can I just go back to, we've talked about some of the challenges that the community can face, but just going right back to just finding out really how you within your organizations identify some of those emotional needs of your community. So how, we all try and develop tools and tricks and platforms to support the emotional well-being of our communities. But how do we find out about it? How do we learn what those needs are? Maybe I can start with you, Roy.
Yeah, I think we'll use a lot of the social media just to see what question people are asking. We are looking what are they asking about, and also in the same when we have these national meetings and when they have the region meeting and stuff, we always, what are people talking about? What are the questions? What are they asking about? And also we are talking a lot with the doctors and the nurses, asking what's the problem, what are they asking about, what's the and we have one meeting every year with the Center of Excellence that we're having the same question, what's the questions the patients have, what they're coming, and what we are asking the doctors, what should we learn the patient before, what can we bring on the table for you. Yeah, so I think that's the but I think the social media, you see there are the 10 most topics that are important. So I think that's the one of the main the main resource for finding out what's the patient's question. Yeah,
I would add to that, Kathy, that it's so important to check the patient's understanding of their disease, where they're at that moment, because if we're not careful, we can assume that they do understand what their diagnosis is. And, we often say we've got a complicated cancer with complicated terminology. So do you understand the difference between stage and grade? Do you know what it means when you've got metastases in your liver? We have to check that the patient understands, and then try hard to gauge through perhaps empathy, active listening, body language, how much more information they want at that point. You don't want to saturate a newly diagnosed patient with too much information at that point. It could be totally overwhelming and therefore detrimental at that point. So it's to try and assess what they understand so far and then help signpost to what would be most likely to be useful to them at that point. I think it's important to check understanding.
Yeah, I think that's a very, very valid point. Thanks, Kate. And I mean, there's also do any of you survey your community to see, what they're missing, what the gaps are in their care or in their education or in their, things that they feel that they need that they're not getting?
We do surveys with all the programs, but I think, and that's helpful. And of course, people leave comments. But of course, the one-on-one, when people say it, right? Quantitative, that is one thing, but qualitative, when they say it in our support groups or through one-on-one, is really powerful. So we do have deeply engaged groups. We have the support line. So we get a lot of feedback all the time, constant, because we have so many support groups, and not just the networking groups. We have ones that are purely psychosocial, just for patient only or caregiver only, and then through our peer support program as well. So we're constantly learning about where the patients truly are at, and what's underlying all the informational and emotional needs. I mean, a lot of people do come to our patient advocacy organizations for information, and yet we learned that that's only a fraction of what they really need. They really need a whole lot more than that, and it comes out through all of the various programs. Education is very helpful. It helps them get informed and make more informed, confident decisions. But it is all the support altogether. And also, we also have wellness programs. So even in the wellness programs, that comes out to where they're at in terms of the psychosocial and emotional states.
Yeah, we offer something called Teach Me Tuesday, and we put out on social media on a Tuesday all sorts of information. You can look up. It can be, well, it's all encompassing. You take your pick on a Teach Me Tuesday, and you can go back on those posts and look at something else that you might want to learn about last month or the month before, and you can cherry pick according to what information you want and what stage you're at with it. So I think Teach Me Tuesday has been really well received.
Oh, thank you all. I was just going to kind of not change the topic, obviously, but just change the slant of what we were talking about slightly, because as advocacy groups, we're all at different stages of our groups. We've all been around for different times and we all work slightly differently. But I think most of you would agree that collaboration is really, really important. And that we can't really work alone, even in our own countries. You've all talked about this with your medical team, or that with, the psychotherapy service, or that with your patient groups, or everyone doing it together. And I just wondered, if not talking about the patient support groups, which obviously we've talked about a lot and an amazing and really valuable resource, but sort of other partnerships that maybe you've had that have really helped sort of expand your efforts around helping people feel empowered or have sort of strong advocacy. And that could be, bringing in healthcare professionals. And I know what Kate might say, because I know what we might do, but I'll let Kate say that. But, from any of you really, what sort of other things, or who else you bring in, who else you partner with? Do you want to start with you then, Kate?
Yeah, I was just thinking, one of our community worked really hard to partner with one of our UK health boards about trying to get neuroendocrine cancer introduced properly and under their care plan, particularly under our neuroendocrine cancer patient pathway. And it took months and months of advocating. She would go back and eventually it led to a one-to-one meeting, and it's now part of their plan formally for this particular health board. And that's just come from a patient advocate continually trying again and again and again to, push neuroendocrine cancer forward. It's things like that can be achieved. They take time, but it can be achieved. And once you see it and you see the result, and this particular incident that I'm thinking of, it's one lady pushing and pushing and pushing, and it's that diligence really that can achieve these good things.
Yeah, and then you of course get the partnerships with those health boards, which of course is different in every country, but they're really required. We can't advocate for great treatments or pathways if no one's going to integrate them into their services. So, you do need those collaborations. But what about with kind of healthcare professionals? And I know we do webinars. Kate and her support team work on bringing in experts to talk to our community on various different topics, as an example. So, I mean, Sugandha, from you, do you do anything sort of in collaboration with other people there?
Yes. So if I talk about organizational level, we've had some the larger umbrella cancer support groups helping us, raise awareness about the NET Cancer Day, especially around that time. We've had some collaborations where they would retweet or they'd become a part of our campaign and help us spread the word around. We've had some in-person collaborations also, but those have been very few because they're limited to one city at the most. And but certainly on social media, we've had collaborations where they mostly around NET Cancer Day, where they help us spread the word. We've had organization for rare diseases in India, which is sometimes, they put up things about neuroendocrine tumors on their website and link to us. So those things really help. At an individual level, we've had some fantastic professionals who've helped us, in terms of talking to the patients or doing webinar and of informal meetings. We've had a nice pain physician who came to help. We've had a psychologist. These are kind of sessions, informal sessions, just with the patients to talk to them, to discuss issues, or just to give some general help about managing pain with your disease and those sort of things. So we've had oncologists, pain physicians, and various specialists who come and informally just spend time online with the patients, answer their queries. So these kind of collaborations really add on.
Yeah, they're really important. So that's brilliant. Lisa, what about yourself?
Yeah, collaborations with healthcare professionals are key and very vital to what we do. And it really adds to the richness, right, of being able to move the field forward. So definitely we have these deep collaborations and put out a lot of educational contests. So we have a very robust YouTube channel. We have monthly podcasts, monthly webinars. We have in-person meetings. Annual conferences that are virtual, and many resources. And then, of course, we have a whole clinical trials section on our website too with videos. So we have very, very much robust resources that would not be possible without these collaborations. And it's a two-way street because we also then better understand what's available to patients. In various parts of a very large country with a very diverse population. So really understanding through that collaboration and invitation with a diverse range of experts throughout the country, not just a key handful or certain ones, so that patients can also see what's possible, that it's not only certain cities, but that they can travel and see or not have to travel and to see an expert in their region. The diverse representation of speakers helps because then you can see and hear different perspectives. It might open your eyes to different things, give you different insights, different things resonate with different people, and also seeing people that don't that may look more like them or sound more like them. And so that's also very helpful. Yeah, so and aside from collaborations with healthcare professionals, which is really vital, it's a resource for us, right? So if we have questions and are needing to learn about things, that helps, and also knowing what is out there. There's also, of course, collaborations with researchers, collaborations with other patient advocacy organizations. People reach out to us all the time, not just from across the US. So, of course, we collaborate with other advocacy organizations from the US, but also from around the world. Sugandha knows this, Benard knows this because I'm constantly reaching out to them. Right? Sugandha, I just did a couple of days ago because someone reached out to me from her area. Benard, I've had several people from Kenya. I mean, people reach out internationally too. And we always want them to connect with someone in their own country or locally if at all possible, because that will help them access resources that are helpful for them. Australia, New Zealand, I know we didn't have our colleague join us, but that's also very common because people get on the internet and they may miss the fact that there's an organization in their own country. So our international collaborations and partnership are very valuable too, and then learning from each other how to do best practices and continue to grow, not just in terms of practices, but also as people and as advocates.
Yeah, for sure. And I think it was Therese also mentioned, I mean, Kate mentioned about, having those collaborations with your health boards and your health services and the people that run, our health businesses in each of the countries. But, the differences that can be made. They had a patient who really advocated for a new drug that they wanted to get on their pharmaceutical benefit scheme, which is something that's in Australia. And that was all down to some, building the community and making sure that there was really strong liaisons with those people who could make those decisions. So I think, there's so many stakeholders involved in the care of someone with neuroendocrine cancer, and we have to build relationships with all of them, right? And I guess one of the questions, as we come to the close of this session is really, I mean, I think education is something that's come out a lot. Peer support is something that's come out a lot. Collaboration, very important. Understanding the community, providing resources at all different levels, across different languages, across different platforms, of course, really important. But relationships are at the heart of this, aren't they? And I wondered, through what you've all done, how, what's kind of a key piece of advice about building those relationships with the multiple stakeholders, whether that be pharmaceutical industry or the doctor that looks after most of your patients or another advocacy organization that could help you. How do you build those relationships? What would be your kind of top piece of advice? And that's a question that wasn't even on the sheet, but it's just come to me, so I'm throwing it out there. I don't know who wants to tackle that one first.
I can say a little bit about Norway, because the pharma industry, we not have anything with them to do. We're not, but the healthcare professional, we are really good connected with them. We are all the doctors, we know them. We are meeting them a lot. We are working together with them, showing that we want to do the same. And one thing we did, we have some money that we were asking for. We have money. Do you want to go to NETs? Can you send some nurse? And that's a really good topic, because then we can talk with them there. We can show them that this job you do is really important. You need to have high class if you want to be a part of this population, like in NET cancer unity. And yeah, so that's really important. And also building up the new doctors, because a lot of the doctors we having working with neuroendocrine is starting to get old. And soon going off with pension, and then we need to lift up the new one. And we as a patient organization, that's really important for us, because our patients, our members, and they need to see that the new doctors that's coming in, it's also good doctors. They know the job, and that's so important, that when they're coming to the hospital, coming to the meeting, and it's not the regular doctor that's standing there, it's a new one. You have to know that this one is superb. He's a really good one. So we are using a lot of incentive to take care of the new one. That's important. Yeah.
I think it's, collaboration is so important, and the trust, and to get back to something Lisa said, our medics that come and do the webinars with us, we must remember that they're doing this in their personal time for us. They're not being paid. They're giving up their family time when they come and talk to us. And we are hugely appreciative of that. And I think it's important to remember that they are giving back themselves, that, they don't get paid. They don't have to come and talk to us. They're doing it because they want to help educate. So the collaboration and the trust.
So how have you reached them though, Kate? I mean, there's a question. How are you getting them to come and speak?
Well, It's a little bit like Rose saying, when there is a medic that's interested or a medic that's been a good speaker at a conference that we've gone to for something else, it's spotting who's willing to pair with us if they're new ones. And then also, like Ray has pointed out, those who are coming up through the ranks, because we desperately want those as well. We recently had two very young researchers from the Christie who wouldn't normally have participated in this, but they came and spoke about the research in neuroendocrine cancer, what's coming, and what they did in their job and how it worked. And it was really interesting because the patient audience had never thought about those things. So it was about collaborating, making it more of an us. It's not you will be done to, it's an us together. And I always like to think that it's the healthcare professional and the patient against the cancer. It's two against one, and try to build on that. And it can be done, it can. And another thing that I think is important, we're always asking something of them when we want, we're sending patients in, we're coaching patients on what to do. But also it's important when we have wonderful feedback about something that went really, really well. Generally, I'll tell the healthcare professional about that, and they then use that for their learnings to their teams. So it's not always, oh, this went wrong, that went wrong. This went really well, thank you. So it's collaboration. Yeah.
Sugandha, anything from you on that particular point?
Yes, so I completely agree. Collaboration and networking are very important parts of all this work that we're doing. Besides this, I think there should be an honesty, and there has to be a consistency in purpose, and which you need to demonstrate over time. And certainly, the right people will gravitate towards you and become a part of the entire intent.
Yeah, great. Thank you, Sugandha. That was a very good comment. Lisa, do you want anything to add to that?
If you're asking about how we as advocates and organizations build these relationships and community, and you're spot on. I mean, it is all about relationships. It's all about community. And that community, those relationships aren't just transactional, as Kate said so eloquently. It is relationships, true relationships. So I think from our attitudes is really an openness to opportunities. Roy really elaborated on how to be intentional, right? In all ways. So looking for being open and actively seeking out opportunities and being intentional then in finding and building those relationships, in being engaging and supportive. So it is a two-way street. So yes, as Kate said, providing feedback. And we have not had issues with speakers saying no, ever. Everyone wants to speak and help. And yes, it is, their own time and energy, and it feeds them too. They might do a medical event, a private event, and then they come to a patient event and they're like, this is the more fun thing. I mean, they really, it fills their cup, despite the fact that, yes, this is their own free time that they're giving away. It inspires them. And so, yes, it is important to also engage those up and coming researchers to find new voices, and to be supportive of their work, to uplift and empower them as well, to highlight their work, research articles, their change in institutions, and bring their voice to the table too. So it is a two-way street. And in that way, we're also engaging and these research physicians, scientists in the NET community, so that they're invested in our disease, in neuroendocrine, rather than another cancer, right? So that's important too. We want that engagement. We want to keep them in this field. But yeah, relationships are important, and you see it among providers, you see it among us advocates, and then throughout the whole community, that we've become a NET family, and that's really what we need, right? To be this community, so we can move towards this common goal and find a cure together.
Yeah, absolutely. Guys, you've been really, really brilliant. Thank you so much for, all of the answers that you've given and all of the feedback and the honesty. If I could just finish with just a question really to each of you about what message that you would give to somebody who feels like their voice doesn't matter. Maybe I'll start with you, Sugandha, because no one's going to put their hand up for that, are they?
So every patient who's going through this, navigating this diagnosis with coming across this challenge of facing a cancer and having to fight a cancer needs to hear it out that they matter, their disease matters, their existence matters, and we're all here to support them in every way possible. There's always hope. There's always more to do. There's always something that can be done to ease their pain, to help them, to support them. And there's a huge community of people rooting for them.
Yeah, that's nice. Oh, get me goosies. Roy, what about you? What would you say to that, to someone who feels their voice doesn't matter? What message would you give to them?
That's not true. The voice really matter. So and use them voice anyway because someone hear it. Somebody, yeah. So I think that's most important, that your voice really matter. Even you, I think that's just a feeling that doesn't matter, because it really does matter. So yeah.
Thank you, Roy. Yeah, I mean, it's very true, and we know it matters. Lisa.
I would say we see you, we hear you, and we care. And you're not alone in this. And there's days where you might not feel like you matter, that there's any hope. And that's okay. We have good days and bad days. And on those days you don't feel good, or you feel like you're wondering, yeah, if your voice matters or if there's hope. You have all of us that are going to be supporting you, that are going to hope for you. You know, you have us, we are your community, and we have your back.
Thank you, Lisa. Kate, sorry, I'm ending with you there, but not on purpose. It's my screen.
I agree with all of those, and I would just say, if your voice doesn't matter for your own health, then whose does?
Yeah, I mean, very true, and that is our role, isn't it, as advocacy organisations. If someone is feeling that way, is to, if we can do nothing else, it's to be the voice for somebody else as well. And I think that's something that when you're feeling like you're not doing enough in your own advocacy organisation, and you're not as big as you want to be, or you can't get the funding that you thought you wanted, or all those things that we're all striving for, you know, if you can be there for one person and hear them, then I'd say you've done a really good job today.
Never stop asking questions.
Sorry?
Never stop asking questions.
No, very true, very true. And we're there to answer them if nobody else is. But you're right. I think this whole neuroendocrine family is true. And I think it's a real thing. And we just need to make sure we bring everyone in and make them very welcome. So thank you for all that you do. And thank you for being here today.
Thank you for having us.
Thank you.
Thank you.